open council time for Wednesday, November the 4th, and deal with old business minutes of the meeting of October 28th. I was not here, but I've read them. But so would somebody like to move to?
Motion to approve, Chair.
Second.
It's been moved and seconded to approve the minutes of the October 28th meeting. All in favor say aye. Aye.
Aye.
Motion passes. Moving on to new business. Kathleen, actually we have removed one item from the new business, which is 2.1, the Fire District 3 request for county to assess and collect fire impacts. As I was looking more closely at it, I was glad to see your email, Kathleen, that we would get to know a little bit more about this before we take action on it. So that has come off of the agenda today. Do we know when it will be back on, Kathleen?
I anticipate the next council time meeting, and next week is a holiday, so it would be the week after that.
Okay, thank you. Okay, so then we'll move on to 2.2. Kathleen, or whomever you have.
Yes, this is a request to the council regarding M1, M2, and M3 wage adjustment to be effective in 2021. Our county does have different job classifications of employees. Just as a reminder, M1 classifications are director levels or deputy directors in elected departments. M2s are exempt employees, so their salary or like in senior management or supervisory positions. And M3 classifications are non-exempt employees or hourly employees that are not represented by union or guild. What I'm recommending is to increase the wage adjustment by 2.2% in 2020. Just a little data, we do have M1 employees. We have about 40% of our employees. We have about 20 that are at the top step of their range. So this would be the only wage adjustments that they would see. For M2 employees, we have a total of 280 M2 employees, and about 17.9%, 18% is at the top of their wage. And then the M3 employees, we currently have about 135, and 62% of those employees are at the top of their wage. The total impact to general fund is about $488,000, and the total, this is the increased amount. And then the total for all funds is just over $888,000. This money is incorporated in the recommendations of the 2021 budget that I presented in a work session last week as well. Historically, if we look at our union groups and employee groups, these work groups have actually been receiving less of a wage increase. So we're now seeing compression issues within our salary. We still want to maintain our employees and maintain competitiveness with that as well. Because, you know, sometimes we are looking at classification reviews, and that may include an external comp review, and it's putting our data far underneath our comparators. And then the history, most of our employee groups have been getting 2.2% increases. There's a couple groups that have received a 2.5% in the recent years. These are interest arbitration groups, so that a lot of them are based on an arbitrator making that decision. I'm more than happy to answer any questions, but I am requesting the council to consider and approve the wage increases of 2.2% for next year.
Okay, we'd open it up for discussion. Any questions of the council? Okay, I'd entertain a motion then.
I would move to approve the M1, M2, and M3 wage adjustments for 2021 as presented.
Second.
It's been moved and seconded to approve the M1, M2, M3 wage adjustments for 2021. Is there further discussion? Hearing and seeing none, all in favor say aye.
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 Aye. Opposed? The motion passes. Thank you.
Thank you.
We'll move on to 2.3, resolution declaring racism a public health crisis. Who's presenting this?
Well, I can start. As I brought forward at the Board of Health and then referenced again at council time last week, this is a resolution to declare systemic racism a public health crisis in Clark County. As we know, this year and for some time before this year, we've been hearing from public health and from community partners about disparities in health outcomes related to structural racism and its impacts on our community. So after this council passed a resolution in June committing to dismantle systemic racism, we also then heard from community partners as well as mayors from 5 cities in Clark County looking to the Board of Health to declare racism a public health crisis in Clark County. So this is a draft resolution to do just that. And from talking with public health, and information from public health was used to draft this resolution. A resolution like this would allow public health staff to continue to direct and refine the plan of their work. And also it would increase our eligibility and competitiveness for grants to work on addressing this issue. And it would also, less tangibly, but very important, to demonstrate to our community that we do take the threat of systemic racism seriously. So bringing it forward here with the goal of, if this council moves it forward, to have it be on the Board of Health agenda for December.
I have a couple questions. I saw that there was an attachment to this resolution that said racism as a public health crisis, created October 17th. Who created that document?
Public health.
And who asked for public health to create this document? Where did it exist already? Or, I mean, October 17th, did it exist already, or was this something you requested? Councilor Lentz.
I didn't request this specific document, but this is something that public health has come and talked to all of us at one-on-ones and two-on-ones. And in trying to get more information about it, they created this document.
Okay. The other thing I wanted to just comment on, could you tell me on what paragraph of the letter that these mayors signed that they asked us to pass a resolution?
I don't believe that I said that, but they did send us this letter asking us to address this question.
You did say it. I heard you say it, and that's what
Okay.
prompted the question and made me lift the letter and say, did they really ask that? They asked that we look at it. So I guess the other question I'd have, in your estimation, what do you believe this resolution actually does? What would you expect it to accomplish?
I just told you, but to go over that again, as I said, a resolution, and as the last 3 pages of that attachment discuss, a resolution like this would allow public health staff to continue to direct and refine the plan of their work. It would increase our eligibility and competitiveness for grants to do this work. And it would also demonstrate to our community that this is a problem that we take seriously.
Are there other questions of the council?
Chair O'Brien, I don't have any questions. I do have some comments.
Okay, I have a whole page full of questions, but go ahead and comment.
Well, if you have questions to ask, I can save my comments, and maybe my comments would be informed by your questions.
I'm wondering if we have the comparison of people of color with other populations with regard to this virus. Like, for instance, how does it compare with the elderly population? That I will pose that question to the presenter of this resolution.
We've seen that data before, and it's very clear that there's a disparate impact, particularly among Latinx community, of their percentage of the population and their and the number of cases, percentage of as the number of cases. I mean, had that information presented multiple times from Dr. Melnick before. So I'm happy to pull it up if we want to go over it again.
That would be good if you could. If you have it in front of you, that'd be great. I mean, do you or Councilor Lance actually believe that this virus specifically somehow has a mind of its own and goes specifically for persons of color? Is that what the...
No, and it's honestly, it's a ridiculous question. The issue is that people of color are often in lines of work, such as the service industry, such as working in food processing plants, as we saw with the first workplace outbreak. Because of the economic opportunities that are there, they are more likely to be in places or in lines of work where they are likely to be exposed. And that's what's at the heart of systemic racism.
So I guess I would be curious too, if at this point in time, what policies would you see coming forward that might change, that we have? Our current policies, what policies do we have or could we change that might help the situation?
That's a good question. And the document that was presented, the one that you questioned earlier, includes a lot of this. And some of the purpose of a resolution like this, as described in that document, and also as with a lot of the work that we do as a council, is that this creates the possibility and opportunity for that work to come forward. We don't have a list of this policy, then that policy, then that policy, because we need to actually say we want to do this work. That's how we do things.
A lot of times I think we find policies and change them. And I think that throughout history, we have changed policies when we see difficulty. But what is the status, do you know, of the availability of health care with regard to race, not income? I mean, doesn't the state of Washington actually provide, and I'm not sure, I'm not even saying insurance, I'm saying health care. Is it not available to people with lower incomes without regard to race? Do
Sure.
we have a policy
That's the
person?
point of the question.
The point, I would like to know the answer to the question, and if you can't, I would like a policy person maybe to answer that question. Doesn't the state of Washington currently provide a form of health care, if not insurance, for people with lower incomes? Don't we have a state?
I'm happy to answer that question. Yes, there is, you know, if somebody meets the criteria to be Medicaid eligible, then they can receive that. But that, you know, there's certainly no race component to eligibility for Medicaid. It's an income component.
And I recall in my discussion with Dr. Melnick, maybe in June, early June or late June, with regard to this. And I think the Board of Health, it could have been in the Board of Health that we had a little bit of this discussion about, you know, whether some of the individuals that had this, that contracted this virus had health insurance or not, and whether that inhibited it. And basically, the answer that I got from Dr. Melnick is, really, they're colorblind, they're insurance blind, they're everything blind when it comes to this virus. They want to treat anybody who is affected with this virus. So, you know, it seems to me that with regard to our health department, that they're doing all they can and simply are blind to the idea of race, or even anybody who has or does not have insurance. So, and I would think that those affected by this, most highly would need some sort of health care in order to address it, even in order to be tested for this particular virus.
And
So,
I think in terms of the question as in terms of the disparate impacts isn't necessarily focused on the availability or the quality of the coverage of the insurance, so much as what Councillor Blum mentioned in terms of the level of exposure that we're seeing to certain groups of people depending upon their profession and the risk associated with the work that they do. And then also the evidence of the disparate impacts once somebody is actually in the hospital, that you could have two people with the same insurance, same condition, different race, and we're seeing different health outcomes nationwide.
Okay, any other comments? Councillor Medbouji, do you have any?
So my recollection, number one, that we had addressed this earlier through one-on-ones, and there was no stomach on the part of the council to speak to this topic further. That the nexus between structural racism and health outcomes is nebulous. And right from the very beginning, John, other councilors had quizzed Dr. Melnick on these disparities on the impacts that we were seeing right away, not only locally, but nationally. And the answer was always uniformly, we don't know. We don't know the science between comorbidities, from sickle cell anemia to diabetes, to being overweight. Clearly, what we were seeing are congregate living situations, congregate work situations, but the science behind structural racism and different medical outcomes is amorphous, and we may not know until the future. To be intellectually honest here, nothing different would happen from having a different resolution. Based on what the health department is doing right now, and you touched on it, Chair, from testing to providing, ensuring health care is giving to those that become ill, whether people are undocumented, uninsured, they have all received the help that the community caregivers can give them, regardless of race. As far as grants and possibilities for that, we are doing the work. And the resolution we've already passed would qualify us equally and allow us to apply for any grants that may be available. So there's no better outcome from passing this resolution. It gets into larger issues of, who do we separate out? Are you talking about socialized medicine for everyone? Are you talking about giving everyone the same living situation, giving everyone the same job, occupation? Our society is a little different than that. And so, I think it's just passing a resolution that isn't based on science. There isn't an obvious nexus, and we won't be doing anything different. We've asked Dr. Melnick over and over again. I personally have, other counselors have, not only on one-on-ones, but in public health meetings. What more can we do? What more money do you need, Dr. Melnick? What other services should we provide? The answer has always been, thank you. You've been giving us everything we need. So I don't think there's anything more that we can do. We are helping each of these groups, as well as we're trying to help everyone in the community equally and give them access to medical care, even if they can't pay for it. So I would like to move on and not consider this resolution further.
Well, I appreciate your clarity about where you stand on this issue. Facts and science do actually indicate otherwise. So I'd like us to consider it.
I'm supportive of this as well. And we have Dr. Melnick sent out a page and a half of facts and data. Apparently not everyone took the time to read that, but it talks about the underinsurance rates. It talks about access to care. It talks about healthy diets. And yes, it may not impact our ability to deal with COVID right now, but what we've seen with COVID, and this is clear in the science, is that comorbidities are tremendously important when it comes to how sick someone gets. And when we talk about better access to healthcare, I mean, thinking specifically of things like type 2 diabetes, if people have better education on healthy food, better access to healthy food, better access to healthcare, that will reduce the occurrence of those things that we know are comorbidities going forward. So yeah, we're not going to help anyone in 2020 with COVID right now because of this, but we will put us on a better path down the road going forward for better outcomes in what lies ahead. So I'm supportive of this. I would encourage other counselors to go back and look at the data that Dr. Melnick did provide in support of this, both now and in a document that he sent out on, July 14th. There's 3 different documents that he sent with different scientific data, both locally and nationally. So the science is there. People can choose to ignore it if they want, but it's there and it's pretty clear.
Yeah, so Madam Chair, I want to be clear. I recall that data and I'm not ignoring it, but nor is there any scientific nexus with structural racism.
Agreed. Well stated. I don't find any nexus either. I don't see it. Councilor Olson?
That's clear.
Yeah, I'm not going to dig into the details of back and forth on science, but I am in support of. When's our next public health? It's December.
Yes, beginning of December.
Okay, all right. So I'm in favor of moving this forward to that next public health meeting. I would like to get Dr. Melnick's input as well, now that it's drafted, and I'll just be prepared at that point to make my statements and deliberation at that time. So we'll in that then.
Okay, and I would just add, thank you. I would just add too that, we have the health department, as I recall, has a program of teaching people about healthy foods. We've passed that. We also have the Fourth Plane Project where, we're addressing a certain population there in various ways. So keep that in mind. I think our health department is doing a lot, but I also agree with Councilor Medviji that I do not see the nexus at all, even with all these charts and measures and et cetera. So, and specifically, one of the statements that was made is that, they have certain jobs that create it. Okay, it's their job, not their race. And so at any rate, it looks like we have 3 counselors that want to bring this forward to the Board of Health. And so we'll do that. Moving on to counselor reports. Any counselor reports?
Well, so I just want to comment, and I don't know if I'm the only one getting them, but I probably got 50 emails just today on basically defunding the police, demilitarizing the police. I don't know if I'm the focus of this campaign. I'm not sure why. And they're from all over the state, not just all over the county. So a lot of out of county. So I don't know what prompted these emails. Are everyone else getting them? It's one email by 50 different people. I mean, it's the exact same cut and pasted email on demilitarizing the police, defunding the police, etc. Is everyone else getting those?
I don't recall if I'm getting those, but I am getting emails from that are very similar emails. The verbiage in each email is the same from sides actually. And I was thinking about, since there are so many emails, at least I would create some kind of an answer for these people. If we want to do that as a council, that's fine. I think that we should probably allay the fears of some of the folks that are writing to us. Well, there are fears, different fears, but fears on both sides that seem to be coming out in these emails, and maybe it should be addressed.
So,
Councilor Olson.
yeah, so Councilor Medved, you're muted, but just to confirm that I got all those emails as well in the same period that you did, so.
Yeah, thanks. So I was raising it so that we did have a response. I'm not, I responded to some of those that were concerned about law and order, imposing law and order. But as far as all these other emails, especially from those out of the county, I'm hopeful that someone can take on the task of giving them an answer.
And I would hope that answer coming from this entire council is that we're not going to be defunding the police or our sheriff's deputies. We want to actually maintain law and order in our county. So, and
Well, given that we haven't even had that conversation, I think that's a pretty safe assessment.
Thank you. Other council reports? Work session requests.
I'm not sure if the mod is still on, but there is a work session request from Public Works regarding fleet, and the purpose is to review the changes and improvements that they've made over the past year and just provide some information for the council to consider and what they're doing with that program. And the request is for sometime in January. And Ahmad, if you're on, feel free to.
Yes, thank you, Kathleen. Yeah, Council, I know we had come in and did a couple of workshops with you over a year ago. But since then, we have done a lot of changes, and then we want to inform you about those, but also a few other policies and changes we're working on that and want to make sure that you meet your requirements and your request. So we just want to inform you on the things we have done and also things we're going to be working.
I say yes. I think we all want to know. So I see other heads nodding. So let's put that on the schedule. Policy report. Do you have anything, Lindsay?
I don't have anything further. Thank you.
Okay, we're going to go into an executive session for one pending litigation, 20 minutes. Is there expected to be action on this?
No action.
Okay, thank you, Emily. All right, we will adjourn our council time and go to our next executive session. We have to sign into that separately. We're adjourned.